Hello, everyone. Good morning. My name is Dr. Behnam. I'm a board certified dermatologist and one of the co-founders of Happy Head. Welcome to another AMA session with Dr. Ben. Please remember that this information here does not constitute medical advice and should only be used for informational purposes only, and it does not establish a patient-doctor relationship. Please do not rely on this information to make medical decisions, and make sure to discuss the risks and benefits of any treatment with your medical doctor before beginning any treatment. All right, guys, let's get started. So the way it works is that, so first of all, today's the summer edition, and I guess we're going to talk about some of the questions later on. Also, for patients that are new or even some recurrent patients, we're going to have some special coupons and discounts at the end of this AMA. So please stay tuned. Here we go. I'm a 71 years old, and I've had thinning on top of my head since my late 30s. Will happy medication work, and is it safe at my age? I only started taking high blood pressure about a year ago. Otherwise, I have no medical conditions. So the answer is, it really all depends on how much hair you have. So if you're complete bald, happy is not going to work. In fact, nothing is going to work except for hair transplant. If you still have some hair there, and so when I look at the scalp and it's just thinning, then happy head could possibly work. The medication, obviously, everything has risk and benefits to it. For the overall, pretty much is safe. And when you submit your information, your doctor will evaluate to make sure that you're a good candidate for it by looking at your medical history as well as your photos. The only thing is that if you are above age 50 and this has finasteride product, you should tell your own doctor that you're taking this product, because if they do a PSA test, they have to adjust the number. Thank you so much for that question. I'm a 67. I have lost hair on top of my head since last 8 years. Will under the product grow hair? I'm taking a medication for high blood pressure. Would love to know, but not waste my money. Again, they basically, you have to really submit the photos so the doctor evaluates it. But as long as you're not bald and you have hair where you're thinning, so that means when I look at your scalp and the hair is there, but just more of your scalp is showing, this is a good product basically for you, either the topical or the oral. Basically, so typically, look, results varies and not everyone's going to see the same results, but as long as you're not bald, at least you're a good candidate for it and it could work, because I don't want you to waste your money either. But remember, these are prescription grade products that doctors give out in their own medical offices, so this is probably the best thing that you can do to get you get hair back. So the best thing to do is just sign up through the website. We're gonna have a coupon at the end of this AMA, and if you're not a candidate, basically, then we'll just cancel and you get refunded. How effective your product versus muesli? Great question. So first of all, our topical finasteride happy, it has three ingredients: finasteride, monoxide, retinoic acid, where our competitor only has two ingredients. Number two, our product is customizable. So if something goes wrong or you don't like an ingredient in it, you let us know. You reach out to Happy Head, the customer service, and we'll modify and customize that product and send it to you. Whereas everybody else is one size fit all. We are not one size fit all. See, companies like Muesli and Hims, they're great companies, but they also do a lot of other things. At Happy Head, we are focused purely on hair loss and hair growth. So we're a dedicated company with dermatologists really trained at trying to treat and evaluate hair loss. So we look at this a little bit differently. We're not trying to do everything else. And so again, our product has a more ingredients in it. It's customizable, and also our ingredients are a higher concentration as well. Even our super capsule basically is very different because it contains finasteride, minoxidil, and vitamin D, whereas a lot of the music products is only like just finasteride. It doesn't have the combination at all. Does excessive sun exposure contribute to hair loss? The answer is no. We do recommend wearing a hat and sunscreen, but excessive sun exposure does not contribute to hair loss. Do I need to wear sunscreen on my scalp? Well, asking a dermatologist, the answer is yes. You should always be wearing sunscreen on your scalp, but the sun itself does not cause hair loss. Can I apply the Happy topical before I go swimming? I would probably recommend not to do it. I would recommend to apply the topical Happy Head after swimming. Can chlorine or salt water affect hair growth? Typically, the answer is no. How can I protect my hair against chlorine? The best thing to do is after you come out of the pool, really just wash the hair. Um, Obviously, if you don't wash the hair, it could potentially, cause some irritation on the scalp, which we don't like. So wash the chlorine off. Should I apply a leave-in conditioner before swimming or wait until after? You want to do it afterwards. And the reason why people will use a leave-in conditioner is because sometimes the topical happy may cause some irritation. So you want to use a leave-in conditioner along with it to reduce some of that irritation. So I don't use minoxidil because of edema. I use topical finasteride and dutasteride. It kind of comes with Regimen, which is mildly irritating. Is there any reason to have the Regimen in this formula? You could have the Regimen taken out. So the clinical studies was Regimen with minoxidil, and it showed that the Regimen could increase penetration of the minoxidil. The question is it necessary to have the Regimen in it if you don't have minoxidil? The answer is possibly it will help a little bit, but it just also be more irritating. So we have to look at the risk and benefits. So the answer would be that if you want the Regimen out, just contact the customer service at Help Happy It. I'm more than happy to take the Regimen out so it's not irritating. Uh, what is the latest on laser light therapy? Does Happy It sell it? Yes, we literally have had two long meetings about it in the past 2 weeks. See, the answer is that we want to find the best laser hair product for you guys. So we are really searching to get the one that fits the best, that is a really high quality and has the most number of LED lights. So the answer is that we're still working on it. Um, and I think we will. Can you please send us an email, and we're gonna put him on the list. We're gonna put him as I already see his name right here. So let's look him up and get his email. I think we're gonna have people basically reserve. You could actually reserve some of these hats before it comes out, and you could probably get a discount if you reserve it. If anyone's interested, just let us know. Email help at happy and say that you want to get on the wait list for the hat. Um, Thank you for hosting and founding your product. Well, I'm very happy that you guys are all getting benefits from it. Honestly, the reason that we started Happy was because you see, in my office, I could only see 1% of the time. But with Happy as a nationwide company, we were really able to expand the product and really just give more access to patients that really needed some help. Can I grow my hair back if the crown is bald? The answer is no. If your scalp is bald, nothing's really gonna grow. The oral super capsule won't grow. Topical happy is not gonna grow, and you might just need hair transplant. I'm 60 years old and I've been using the finasteride minoxidil for hair loss for about a year and a half. I'm not I'm not noticing much addition loss, but not any progress either. Should I be considering a different cocktail? Yes, my recommendation would be to add. So first of all, what may be going on is that the topical might just be maintaining you and not necessarily so which means preventing more hair loss and not causing more hair growth, which sometimes by itself is beneficial. I would recommend to add the super capsule, the finasteride minoxidil combination to the regimen. So it's actually sometimes better to combine the topical with the oral, and it's called sandwiching. And actually, when you do that, you actually do get a discount. So I would not stop one, but I would add the other one and do it for 4 6 months and see how I do. Uh, this is my second chat, and it's been so informative. I started about 4 weeks ago. Um, and where I put the solution on my scalp has become very dry. Is there a solution with no alcohol in it? Yes, we do have a couple of things you could do. First of all, you could use a leave-in conditioner. Number two, you could only use the product once a day and not twice a day. You could also use like a hair scalp serum that you could buy on Amazon that's just more hydrating. They could apply to the scalp. Um, Number three, we could modify some of the ingredients for you. So you could reach out to us and we could lower the minoxidil concentration and remove the retinoic acid, and that could help. And fourthly, we do have a water-based formula that you could request. So just send us an email, say I want the aqua space formula. Basically, there is 80% natural ingredients, kind of like aloe vera and everything. So it's more botanical and does not have alcohol in it. So just reach out to us and you could either request just kind of modify the formula or just go on the water-based formula, and that will reduce the irritation. Um, so when does the dread shed stop, and when should we be concerned and contact the staff? So typically it takes about 6 to 8 weeks for the shedding to stop. So obviously if it's not to stop by like the second month or second 2.5 months, please reach out to us and we could probably modify the formula. Um, let's see. Please let us tell me more about your shampoo and conditioner and how it could be helpful. And is it worth it? It's a great question. So first of all, the shampoo was designed by us, specifically me. We basically reviewed all the clinical studies about what ingredients specifically are in a shampoo, are needed in a shampoo that will promote hair growth, like anti-DHT. So we took the shampoo and do you have any of the shampoo here? And we infused it with biotin. So it's a biotin shampoo. We also added argan oil, biotin, and collagen, and also saw palmetto. So a lot of these are anti-DHT, and it really feels great when you put it on, and it does help in conjunction. It just helps it. Remember, the shampoo alone by itself is not going to cause the hair growth, but you use it in conjunction with the topical happy head or oral happy head. Is all together basically that's going to help. So we have the shampoo and also we have the thickening conditioner, and they're both basically really good, and they're paraben free, sulfate free, and cruelty free. So the combination does help. Can you please give a quick demonstration the correct way to put the medication on and massage it in? So do we have the medication here? So, okay, guys. So here is the Happy Head bottle right here. So first of all, with every bottle, when you do a pump, it goes basically halfway. Now this bottle, if the product is a little more yellow, just because it's been sitting around the Happy Head office for a while. So the red name basically makes it a little more yellow, but usually yours is not going to be the yellow. So the way you do it, basically, you just go onto the scalp, and here I'm just going to demonstrate right here, and you're just going to pour it in right here in the scalp and just rub it on your hand right here like that. Very simple. And you do so every pump goes halfway and you just do another pump. So in this instant, basically I did kind of the front. Now I'm gonna do the crown area, go to my back, and you could do multiple drops here and there, and now rub it in. So basically a lot of people do like a half in the front, a half in the back, and they do this twice a day, morning and night. Again, if you, let's say you're only losing the front, you could do 2 pumps directly in the front. So each pump is about half ml. So you want to do 2 pumps to achieve 1 ml, and it's 2 pumps twice a day. Really as simple as that. And then at night, what you could do once you put it in, you could take a derma roller. Do we have a derma roller here? We had one. We could take a derma roller and gently roll. We don't have one. Actually, I may have one next door. Actually, okay, in Dr. Sean's room. You want to try it? Actually, I'm going to demonstrate how to apply the derma roller and gently, basically roll back and forth. Francesca's good. Thank you so much, Francesca. She's going to get it for me right now. Why twice a day instead of once a day? So you could do it once a day. We have found out that if you do it twice a day, that it's actually going to work better. So a lot of people do it twice a day, at least at the beginning, like 3 to 4 or 5 months, and then go to once a day. But look, you could just do it once a day, and every bottle is probably going to last you like 2 months. But twice a day will give you better results. For fertility reasons, I quit finasteride. Finasteride helped me maintain for 5 years. I've shed a lot of hair for the past 3 months. I'm now restarting the finasteride. Is it possible to regrow what I've lost? That's a great question. So the problem is that you were on finasteride for a while, and then basically you were actually at that equilibrium stage. So by removing the finasteride from your regimen, unfortunately, you kind of disturbed that equilibrium. So that's why you started to shed. So using the finasteride again, you may be able to achieve that equilibrium, but it might take a while. I've lost about 20-30% of my hair. Will switching to finasteride help? Yeah, switching to finasteride, it could help. My recommendation would be actually to go on the super capsule, because the super capsule, because The super capsule it has both the finasteride and minoxidil and vitamin D, and is honestly is a better formula. So, and there's a super capsule with dutasteride and a super capsule with minoxidil. The benefit of it is that it has both the minoxidil and dutasteride in it, so it will help you better. So, if I were you, I would go with the super capsule. But remember, it may take a while for you to achieve that equilibrium again. It could be 6 months, 9 months, or even a year. Uh, let's see. Is inflammation a possible cause of hair loss? Yes, it's possible. So if you have a lot of inflammation basically on your scalp, um, that could cause basically more itchiness, and you scratch at it, and that's what causes the hair loss. So you have to cut down, so you have to kind of reduce the inflammation, and there's some ways of doing this. I know Happy is going to come out with their anti-dandruff formula, where it has a topical steroid known as clobetasol, and clobetasol will really knock down the inflammation. We haven't come out with it yet. That's not live yet, I don't believe, but it should be soon. So inflammation, you're correct, it is bad for you. um, does the minoxidil work for does minoxidil pill work for the thinning the center of my head? Yes, it could work. I'm a big fan of oral minoxidil. That's why we have it combined with the finasteride and the dutasteride and the super capsule. It's a vasodilator, increasing blood flow to the scalp, and by bringing more blood flow to the scalp, it brings more nutrition, no, more oxygen, and it also it washes away the DHT, and that causes hair growth. So I'm a big fan of the super capsule. So if you do the oral minoxidil super capsule and a topical happy that's minoxidil, patients do really good results. Oh, by the way, so Francesca got me the derma roller. Guys, this is the derma roller. So after applying the topical happy aid, you could gently roll, and guys, it's really gentle. Look at this going back and forth, really gentle. Don't put too much pressure. Now, right and left. And what this does basically creates tiny holes in the scalp. And there was a study basically that was recently published that showed that people are on topical minoxidil and only I think 5 or 10% saw improvement. But when they did topical minoxidil with derma roller, I think almost 80% saw improvement. So using the derma roller is super, super important for the results. And I would recommend applying the topical happy at first and then derma rolling afterwards. How often should you wash your hair? I typically would say about 2 to 3 times a week. How often? I mean, you can wash your hair every day. But actually, let me rephrase that. You can wash your hair every day, but you use a shampoo maybe every other day. How often do microneedling for absorption? I would actually recommend doing the microneedling every night. After apply the topical, do the microneedle every night. Remember, the microneedles come in different depths, so the depth I recommend is 0.25 depth, and that's the one that we still have yet. I got a transplant a year and a half ago. I got off the minoxidil and finasteride for 5 months, and then my transplant hair fell out. I got a kitchen sink, and my hair came back better than ever. Yeah. Why did my transplant hair fall out if it was DHT resistant? That's a very good question, but we do sometimes see that. Look, when we do transplants now in our office, we're actually putting people on topical happy head and also the super capsule, because the super capsule and topical happy head honestly do help your transplanted hair. It doesn't mean that there's transplant is not going to fall out. You're right, it is supposed to be DHT resistant, but sometimes it may still fall out. So our recommendation is do all together for better results. Does topical does topical dutasteride go systemic like oral? So the dutasteride is a bigger, basically molecule with a higher chemical weight. So it doesn't go as systemic as the finasteride. Uh, that's correct. And so in some instance, basically that could be better. Also, we just introduced the liposomal formula. So it's basically finasteride in a very special formula, and the liposomal supposed to, according to clinical studies, prevent the absorption of finasteride systemically. And so if you guys are any on topical finasteride and may have any side effects, you could go on the liposomal formula, and it could help quite a bit. I lost all my hair on my body. I took a product that caused my hair to come back, modestly, but started to come out again. I tried the product again, but I slowed it, but no hairs on my legs. It's Steve. So basically, what's going on is that some people just have an autoimmune condition where the body attacks the hair follicles, and basically you lose a lot of hair all over your body. The I believe that the oral super capsule is probably the best treatment for it. But sometimes that may not help either. I mean, a lot of this, unfortunately, is autoimmune condition. Can I switch from oral to topical and vice versa on a weekly basis? Is it better to take oral when I'm more active sweating, like when I'm sweating more rather than topical? Great question. I don't think anybody has done that. I mean, obviously you could do whatever you wish. I would probably not get on and off the oral. I would probably keep the oral consistent and kind of get on and off the topical. So keep the oral consistent, but the topical get on and off. That's what I would do. I'm on the thin mint topical. Can I take the super capsule or oral monoxide a better add-on? I would do the super capsule. So if you're on the topical thin mint, adding super capsule will make the results much superior. We have a lot of patients in our office that initially we were testing this out, and those patients did the best. Because think about it, it's called sandwiching. You're doing it topically and you're doing it orally from the inside. As long as you don't have any side effects, that's the best way to go. Is it safe to use a topical, take oral plus supplements? Yes, it is. Well, as long as you're not having any side effects. Uh, it is. My recommendation is to titrate things up. So you don't want to start taking the super capsule every day and topical every day right from the beginning. You want to titrate up slowly. By that I mean basically the topical. You could start with the topical, do it once a day for the first week, and then twice a day. And you could add the oral, and the oral basically titrate up slowly. Kind of like start with twice a week, then 3 times a week, then 4 times a week, adding one super capsule per week until you're doing it every day. And by doing it slowly, you will not only lower and minimize your side effects, but at the same time, you're probably gonna see good hair growth as well. I've been using the minoxidil and spironolactone mixture. I noticed some skin on my scalp becoming dry and flaky. Is there a solution to help this? Um, yes, there is. Well, one, you could use a leave-in conditioner. Two, you could use it once a day as opposed to twice a day. You could also buy this. It's called scalp serum on Amazon by Head and Shoulders, and it's just a hair serum that could apply directly on your scalp that will reduce the irritation. Okay, dye my gray hair in summer could affect my actual treatment. I take the dutasteride minoxidil and it's dyeing harmful for my new hair? Great question. So, in general, dyeing your hair is not great, but there are a lot of caveats to this. But so if you go darker, it's kind of okay. So let's say if you have gray hair like me, and you go darker, I do have gray hair as the kids, and you go darker, it's okay. But if you want to go blonde, like if you're dark and you're going blonde, that is really, really bad because the process of blonding your hair, basically what it is that you are stripping your hair. So you have to use peroxide. You have to strip your hair of all those pigments, and that could really cause like a lot of hair damage. So going lighter or highlights is actually not a good idea. I would try to avoid dyeing your hair as much as you can, um, and I would definitely use safer products that doesn't have a lot of peroxides in it. Hey, Dr. Ben, I was wondering, so even if we have some micro bald areas with really thin hairs around it, as long as the follicles are still present underneath the skin, could nice denser hair grow back? Not really. So what it is that um, so what's going on is that your hair goes through a process called miniaturization, which means the hair thickens up and it goes into like a smaller hair and then thinner hair and then thinner hair and thinner hair. But there's a point beyond that basically that you pass a certain point that hair is not versatile at all. So what you can really see this when you use a magnifier. Probably one of these days we'll bring a magnifier on next time and we'll demonstrate this live. So what it is that if when you look at someone and they're thinning and they're not bald, they're thinning. So what it really means technically is that a lot of those hairs have miniaturized. So they have a lot of like tiny hairs, like miniaturized hairs, but those hairs are not completely dead yet. They have not miniaturized beyond a point of no return. So by having those kind of miniaturized hairs, those hairs could grow back, but if past it beyond a certain point, it's not going to grow back. So this is why it's so important to be proactive about it and try to treat the hair loss as soon as possible before the hair dies. How often should I be brushing my hair? I mean, you could do it daily as long as you're not pulling out your hair and not very aggressive. You should be fine. Is it true that braiding my hair will reduce hair shedding? That is not true at all. In fact, braiding your hair very tight could actually lead to more hair loss. I actually had a 9-year-old girl whose cousin braided the center part of her scalp really tight, and they braided so hard they actually killed the hair follicles, and she ended up with a permanent scarring in the scalp area. And also, braiding your hair will cause more pulling on your hair in the frontal hairline, and that's going to cause traction alopecia. So, braiding your hair is actually not a good idea, especially if it's a tight braid. I only want to apply once a day. Can I do 2 ml at once? Good question. The only problem with that one is that it could sometimes cause a little much too much irritation. So I recommend probably doing a 1.5 ml. See how you do. Start with that first, and if you do okay with 1.5, then move up to 2 ml. And as long as you're not having irritation or side effects, you're fine to go. Have you considered adding caffeine to your product? Yes, we have. We're still trying to figure out the efficacy of caffeine. Honestly, look, our product is a medical grade prescription product, so we really don't want to jeopardize the effectiveness of our product by adding something that's really not that effective, and it could sometimes even be more harmful. So we're still evaluating that. Is DHT a problem in female pattern hair loss? Yes, it is a problem. This is why patients that take oral finasteride, females that take oral finasteride works. But the problem is that we don't give finasteride to females above age 50, to females below age 50. But yes, it is a problem, and that's why, like for example, like oral spironolactone could work for females. And in fact, we are coming out with a female version of super capsule, and I think is it available yet? I think it just
Yes.
became available. What a female version of super capsule is basically oral minoxidil with oral spironolactone combined together. Oral minoxidil is a blood pressure medication, as you know, that's a vasodilator, so it increases blood flow to the scalp. And oral spironolactone is a DHT, it's a testosterone blocker. So we're having a testosterone blocker with a vasodilator all in one, and that could help quite a bit. So for females that want to get on a pill, just one pill a day, it is a female super capsule that we just launched, that just came available. It's just easy to do, and honestly, patients see really good result. The demo is great, what he did in the crown, but about one who has thinning on one side. Do you put a solution there or just the crown? No, you want to put the solution where you're losing your hair. So, for example, I have a lot of females that come in and they are thinning right there in this widow's peak or kind of on the side. So, what they do one pump and apply to one side. They do another pump and apply to another side. And then they take the derma roller, and gently roll up and down on the sides. Gentle, guys. Don't put too much pressure. The pressure should be the same pressure as you're applying your deodorant on. And also, don't make yourself bleed. If you're really getting there making yourself bleed, that's not a good idea. Also, don't keep it in the same area. You want to keep moving it. The only side effect, the only once I saw a scar from a patient using it was one, he was using a really deft a derma roller, and number two, he just basically would just sit there and for 15 minutes go like this in the same area. Well, that's going to cause a scar. Well, do not do that. I'm gonna finasteride minoxidil topical. Should I add a super capsule? Yes, I think adding the super capsule will help you quite a bit. It's gonna give you a boost basically to your hair growth. As long as you don't have any side effects, you're good. My recommendation is please titrate up the super capsule to minimize the side effects. Okay, a dermatologist prescribing ketoconazole shampoo. Why? Great question. So the answer is ketoconazole is antifungal, and it's been shown in clinical studies to be as effective as like topical minoxidil, which means that it could take some of those mini tracer and basically thicken it up. And I think don't we have that on our website yet? I don't think we have that with the ketoconazole shampoo yet, but
Not yet.
not yet. But we'll be offering it. Look, is it a game changer? No. Does it help? Yes. And if you do the topical ketoconazole with topical happy and oral super capsule, is going to do even better. Uh, the problem with ketoconazole is that sometimes it could cause some irritation, so it could dry you out a little bit. So my answer to that one is, use a ketoconazole shampoo kind of every other day, and then those other days that you're not using ketoconazole shampoo, just use it like a regular shampoo, or like the Happy Head shampoo that we have, the thickening shampoo. Great question. Thank you so much for asking that. Would taking testosterone for libido and energy be like putting gasoline on a Yes, on far. Yes. That's a good way of putting putting it. So the problem is that testosterone will increase your DHT level in your body and will cause more hair loss. So honestly, some people need it. I mean, if you need it, you need it. Now, if you're taking it, one way to counteract some of the bad side effects of testosterone is to go on a super capsule or the topical happy head. But in general, we try to discourage it. How long does it take for you to see results? It's typically 4 to 6 months before you see improvement. And if you combine the topical happy head with oral super capsule, you will see better, thicker, and faster results. I've been using the happy head since February. The topical minoxidil finasteride has seen little results. Any solution to this? It's only been 4 months. I would probably give it another 2 to 3 months. Also, you could add the super capsule for better improvement. Also, we see this all the time in the office. Patients come in and like, doc, I don't see any improvement. So then what I do, I take my fancy iPad out and I take a photo and I compare it to the photo that we took 6 months ago. And behold, there's a huge improvement. So the patient always surprised, like, wow. And this is what they tell me, and this actually happened yesterday. Doc, I had forgotten how I used to look. And the thing is that you look yourself every day, so people really do forget. So the key is take a baseline photo and really monitor it. And number two, you can always request your photos that you uploaded to us as well. But really, people just do forget. You look at yourself every day. It's called the pregnancy paradox. You know, when your wife or girlfriend is pregnant, you don't really see the day-to-day changes that she's getting bigger. But if you actually take a photo on month one and take another photo by the seventh, trust me, she's gotten a lot bigger. So again, you look at yourself every day so you don't see day-to-day changes. But in your case, I would probably add a super capsule for better results. Is taking liquid collagen orally beneficial? Yes, it is. I do like it. Um, and one more thing. So where do I buy the super capsule, and are there any side effects? Super capsule is on the website. It's on the Happy Head website. So if you go to Happy Head and go under the products, you see the two super capsule products. Also, are there any side effects? Well, it is oral minoxidil, and oral minoxidil is a blood pressure medication, so it could lower your blood pressure. And sometimes, very rarely, it could cause chest pain, shortness of breath, headaches, and heart palpitation, but those are rare. Oral finasteride does carry a risk of social side effects, but if you guys are using the topical Happy Head first and then add the super capsule, your body probably has gone used to the topical Happy Head, so it minimizes the side effects. So you potentially lower the side effects of when you add the oral. So, okay, guys, well, thank you so much for joining us. We really appreciate it. You guys are what makes Happy Head special. And it's really you guys that basically help us to make better products. Um, and I would really appreciate if you guys get on Trustpilot and please write us a review. I really appreciate it. Also, if you're a first timer, you can get 60% off your order by using the promo code AskDrBen60. And if you are a current customer, you could get 15% off if you put a bulk order of 5+ bottles. Or if you combine, I guess, different things together, you could get that 15% off. Again, guys, we're here to basically help people get their hair back. Um, and again, and hopefully we could help you guys. One last question: why doesn't the woman's super capsule doesn't have finasteride? Because if you're below age 50, we don't want to give finasteride because finasteride is category X. So, and you should not get pregnant on it. So the woman's super capsule formula does not have finasteride, but has spironolactone and minoxidil. If you're female above age 50, then you could do the male, the regular super capsule, which does have finasteride in it. And can I take the super capsule with the hair growth supplements at the same time? The answer is yes. What if you're taking another blood pressure medication? You have to basically ask, first of all, when you're applying online, you will write that down, and you also ask your doctor as well, but our dermatologist will also evaluate that. And also, is it right to shampoo and condition twice a day? I would not do it twice a day, honestly. I typically recommend using the shampoo and everything like every other day. So you can wash your hair. Okay, maybe shampoo once a day, but definitely not twice. I think that's too much. All right, guys. Again, we really appreciate it. Thank you so much for getting on board with us. Again, please leave us a review on Trustpilot. We do need some help to really getting our to get our Trustpilot score up. I really appreciate it. Thank you so much for joining us. Again, this is Dr. Behnam. Have a beautiful day. Bye bye, everyone. See you guys in a few weeks.